Sickle cell disease, as a background, is an inherited condition that causes lots of problems. So patients can have what we call acute episodes of illness, but it's also associated with progressive organ damage. And these episodes can shorten the life expectancy of patients. Sickle cell disease can be cured using bone marrow transplant techniques. And there's increasing evidence that perhaps gene therapy is also a potential treatment, a curative treatment for patients who have sickle cell disease. Despite the curative potentials of both bone marrow transplant and gene therapy, these treatments are very expensive and are not available to the vast majority of patients who have sickle cell disease. Many of these patients live in resource-limited countries in sub-Saharan Africa and in India. And so it's important that these patients have access to treatments that are affordable as well as safe and effective. And most of these treatments are drug therapies. And so what I talked today was about the drugs that are available at this point to treat sickle cell disease, those drugs being hydroxyurea, which has been available for a while, and a drug which just got approved last year called L-glutamine, which has been shown to decrease the frequency of sickle cell-related complications like painful episodes and acute chest syndrome as well. The other thing I talked about was the fact that there's increased enthusiasm for development of new treatments and new drug therapies in sickle cell disease. And so I went over some of the treatments, some of the trials that are going on at this time as well. I think the biggest unmet need is the fact that these patients have a reduced life expectancy. So that's why we are trying to do all we can to try and improve treatments. But there's also the challenge of access to care. So there are very many patients with sickle cell disease who do not have access to the right kind of expertise in terms of doctors taking care of them. So while there are very many doctors, qualified doctors in resource-rich countries like in the UK and in the United States, the number of doctors who have expertise in sickle cell disease are not very many. So there are very few doctors. And so what we try to do is to try and see if we can provide resources to primary care providers and general practitioners so that they can take care of sickle cell patients as well, working with haematologists who have interest in sickle cell disease. I'm looking forward to meeting people, networking with people who have an interest in red cell problems, sickle cell disease, and I'm also looking forward to hearing what's new in the area as well.